Welcome to Complicating the Narrative, a podcast that takes on the challenging questions in public health by embracing complexity rather than avoiding it. I'm your host, Salma Abdullah. We often think about health environments as physical spaces, the neighborhoods we live in, the air we breathe, and the food available in our communities. But increasingly, our environments are also digital. Social platforms, search engines, and now AI systems shape how we learn about health, what we fear, and what we believe is possible. Yet, we often treat these technologies as tools for communication rather than environments that shape population health in their own right. These technologies have the potential to unlock a new era in clinical and public health research and practice, but they also have many limitations that may exacerbate existing health disparities. I believe we're past a point where digital footprints, machine learning, and AI can be seen as niche areas of research interest within public health and medicine. I think we need to have more conversations about how to incorporate them in our work, where the blind spots are, and who's being left out as we increasingly rely on them. My guest today has been thinking about the best way to use these technologies in a responsible way. Dr. Yulin Hswen is an associate professor at UCSF, whose work examines how online behavior and algorithmic systems influence population health and how we can use big data and AI responsibly to understand society's health patterns. She also serves as an associate editor at JAMA and JAMA AI, giving her a unique vantage point on how the field is evolving and what standards are needed to maintain scientific rigor. Yulin, welcome to the podcast.
Thank you so much for having me, Salma.
Yeah, so I usually try to start with the journey because I think a lot of people really try to connect what got you interested in a certain field and ultimately where you ended up focusing on with your research. And I can see from your journey that you have a lot of experiences in epidemiology, public health, but also in data science. I'm not going to mention acting for now. We'll leave that for later. But I wanted to first know what drew you to thinking about health from a digital and a computational science lens.
So it's interesting because, no path is ever straight. So I went, I went to school, at the Harvard School of T.H. Chan School of Public Health. And I was very classically trained in, epidemiology and biostatistics. And so I had that base of ultimately really trying to shift populations to be healthier, right? And then also from a lens of disparities. So not increasing the gap, but trying to reduce it. But what actually got me interested in the field of data science, but really online data, is really from personal experience. I think a lot of passion in general for people comes from an area where you've had that type of experience that really fundamentally changes how you think or how you act. And one of those was, you know, going through my doctoral program, I got quite ill and I went to go see a physician and I had a really terrible experience. They were really dismissive, just quite disparaging over my health condition. My eyes were extremely swollen. I really couldn't see out of them. And I felt very gaslit that it was, it's all in my head, even though it was visibly there, but they dismissed it as it was nothing. And so, for me, it made me go to the internet and made me go online to search for what was wrong and to figure out my health problem because I didn't want to go back. I didn't want to go to the health system, which I have health insurance, but took me forever to see a doctor in Boston, Massachusetts, right? One of the, supposed best healthcare systems, in the United States. And going online, I really realized that so many other people were feeling the same way, right? They put so much health information online, but that we were seeking so much information online, whether or not, let's remove beyond the fact that, whether it's accurate, whether there, is issues with, again, knowing whether or not it's evidence-based, but the fact that I did not want to go to the traditional health route and, I was in the field really made me think that, okay, this is where the field is going to. This is where people are turning to.
Yeah.
And we need to listen to them. And we also can really actually better understand people's health conditions, but we can also potentially intervene as well. So that's really where I really started. And then going forward, trying to find out who is doing that type of research. And it ended up being Professor John Brownstein at the Computational Health Epidemiology Lab at Harvard Medical School. And so doing research in that lab where they were collecting this type of online data and being able to predict disease. I mean, it was epidemics at the time, now it's pandemics. But in general, I found that you could actually use this data to be able to model what was happening. And then I kind of took it a step forward and coming from the background again from that kind of disparities lens, but also, looking at social factors, social determinants of health, took it to more along the lines of kind of understanding social norms and behaviors versus like infectious disease. Because I became very interested in understanding how those type of shifts in people's just overall beliefs and behaviors was really being seen online first before you would actually see it kind of in the clinics again because of all those factors that I spoke about and much more.
Yeah. Um, if I think that's actually really interesting because we in Sudan, and again, not a place that you would think of as. So I'm from Sudan. My family's in Sudan. Not a place that you would think of that would have a lot of technological advancement or even a lot of data you can trace digitally. It was very interesting to see that there are a lot of things that I hear from my mother before I go to the clinic that she saw through WhatsApp messages. That then I actually get my patients talking to me about them, and those are not things that I can hear when talking to my colleagues or even things that I was studying in medical school. It was just things that my mom actually would talk about them, and then I will see that in the real world. But I never thought there is a good way to do that with WhatsApp, just because we know WhatsApp has a weird encryption that wouldn't allow us actually to track those information. But for a while, my mom became some sort of a source for me if I'm in a primary care setting. What to expect if people in the neighborhood are coming? What type of information they might actually be talking about that they're not getting from us? They're getting from each other or other digital traces. So I actually do think, yeah, that's a really untapped areas. And I always think about it from the lens of someone in a country where my mom might not necessarily have access to really helpful YouTube videos that she can listen to, but can just have immediate access to WhatsApp messages that are translated. That could be accurate or not, but certainly are going to be reflected in her health behavior. So that got me really interested in the type of work that you're doing. So if I looked up your name online, it would say you're a computational epidemiologist. Can you tell our listeners what that means, the people who might not be familiar with the term, and how is that different from someone like me who would call myself a traditional epidemiologist?
I think it's really the computational part really is kind of the blending of computer science methods and then using traditional epidemiological kind of study designs.
Yeah.
I would say that that's probably the best way to describe it. The component that I add is the kind of big data, but the online data. So a lot of the times, again, the data that I'm using is in the millions, right? And you don't necessarily have that in always the traditional form, right? And so you need to use all these other types of kind of computational methods to be able to aggregate the data, to collect it, to analyze it, and then again, these just kind of different layers of complexity that is, I think, different. Again, just different types of methods that are used in the computer science field that is not always used in the traditional epidemiology realm, right? So, for instance, like natural language processing, and area of interest of mine is understanding human emotions and sentiment and how that spreads, throughout populations. Because I think that again, we are not logical creatures, but we're emotional and we make decisions based on emotion. So if you can track that and you have to find a way to kind of analyze that, um, is a method that isn't really used, I don't think, as much in the traditional epidemiological sense. Um, yes,
Do you
that
think
example.
Yeah. Do you think the hope then, and not hope, maybe even the future would be, given that we have a lot more access to big data, that one day every person who's quoted as a traditional epidemiologist is someone who's also using computational science? Or do you think there's still space for people who are not necessarily using computational science methods?
Yeah, I mean, I don't think I'm actually a very big traditional person in
Yeah.
general.
Yeah.
I think that tradition needs to remain. So, like, that's all the way from, like, you know, traditional all the way from qualitative methods to survival analysis, right? I don't think that those ever cannot be taught. I think those are very important. I think there's different categories, right? You can either have someone you can have someone that has training in kind of both, that does both, or which is actually more of my hope for the future is more interdisciplinary, where
Mm.
you have someone that is very traditionally trained as an expert and is still growing that field, the traditional methods like causal, like inference, methods, right? That are still very traditional, epidemiology. And then you have, computer science methods that are an expert in that area, right? From generative AI, right, to multimodal kind of analysis. And they work together to be able to kind of solve these world problems, right? Because it is a challenge in general, especially just in the fields. Overall, I think in this world, things are moving so fast, right? But it's hard to keep, it's like reading different textbooks or a different book, right? It's hard to be so updated in every single field. But if you are an expert in a single field, you can kind of keep moving on in that area. And that's also how traditional kind of grants work, right? You have an expert that's in ophthalmology or neurology, and you have someone that's an expert in epidemiology or, again, communication, for instance, right? I'm not a communication expert, but you have to work with people in communication because goodness knows that, us epidemiologists are terrible at communicating, which is, I think,
Yeah.
if not 80%, 90% of the battle, I think most
Yeah.
of the time that we're not very good at.
Yeah. No, no, I fully agree with that, especially the part about us being not so great at communication as epidemiologists. But so we use the term big data, and I think so. I've been going through your research, and as I say to always with people here, I swear I'm not stalking you, but there are a few really good papers that I liked that I thought might be helpful for someone who's thinking about who might have heard the term big data before. Which usually, I think the promise that is being sold is that because you have such large amount of data, as I said, in the millions, scale could compensate for a lot of the issues that we might have in traditional type of data we use, surveillance data that might be collected. Of course, there are other properties for big data, but I thought it might be a good place for us to start just introducing people to the concept of big data. If you talk about I think there's an article you published in the annual review of public health with colleagues thinking about equity and using big data in public health research. So if you can walk us through the 5 V's that people think about when they think about big data, and then the sixth V that you introduce.
Thank you so much. So that was uh that was a lovely team that I worked with. It was just absolutely amazing. Yeah, it's led by, Paul Wesson, who is an assistant professor at UCSF and a colleague, and Margaret Hanley, who is the senior author of it, a professor at UCSF. And it was great to be able to kind of contribute that 6V because traditionally you kind of had these five kind of prongs of big data, right? So you have velocity, which is kind of the speed of that data is collected and processed. And that's, again, similar to the online data, like real near times and large amounts of streams of data, which is then the volume, which is the size of the data. So it's in terabytes or even larger now, right? I think there's the value of it as well, which is how useful it can be in kind of decision making. There's the variety of it, which is the types of data that we have, right? So it's like the structured, unstructured, multi-factor. It wasn't included at the time, but now it's multimodal, right? You have like images, you have audio that need to be analyzed that you don't always necessarily get in traditional data. And then veracity, which is the authenticity and the kind of accountability of it. And so those are like the kind of traditional 5 points. And I never like to say, again, I told you, I'm still a very big traditionalist in a lot of sense. And I don't want to ever say that, big data or this type of data is going to replace traditional data. Like I said, I think qualitative interviews are so important, but For instance, especially with this type of data, a lot of it is kind of unstructured, or a lot of it is really qualitative, right? It's people speaking about their thoughts and feelings. And when you have it in this such a large amount of size, you need these kind of computational methods to be able to analyze that large amount of data. So when we were kind of thinking about these kind of like 5 V's, we really didn't feel like there was this type of sixth V. And so I came up with this idea of like that it should really be about virtuosity, which is this kind of ethics of big data, right? And so it's really honing in on these biases, but also the accountability of, who is both producing kind of the data, as in maybe the platforms or even the people, but also the positionality, because everyone has a position, right? Everyone has a stance. And another thing in this world is it's become very political that you always come with a certain vantage point, right? And you don't see someone else's because you either haven't had the experience, but you need to understand that. And so that was a really important point that we wanted to kind of add in this overall kind of review of the literature, and to really try to emphasize this again idea of like we cannot have this big data kind of analysis without this virtuosity, where we're always kind of thinking of, okay, what is best for everyone, including certain populations that are excluded, and including ones that, especially with online data, there aren't, we don't always get to see or hear them. But sometimes you can, because a lot of populations also, again, as I said, that are traditionally maybe underrepresented or have stigma or that don't feel like they're heard or seen. We can get that information online because people talk a lot more online about their true feelings than they really do kind of in person or to their physician. So I think that this article kind of emphasizes that, but then also kind of goes through the kind of strengths and weaknesses and like what we think kind of should be done, which is again is coming from more of that ethical lens that I think we should all be having.
Yeah. It's interesting that you said then people talk more honestly online than they would do in person, which actually links to what I was wondering about as well. Which this is great that we want to use big data and we need to think about equity considerations as we use big data in our analyses. But then, do you think this approach of listening at scale
Hmm.
could that have some tension with privacy issues? And I'm still trying. I think that's going to be. I know that's this could be addressed in a lot of the analysis we do, but I thought that was a thread that went through, I guess, as I was thinking about this episode of where do we draw the line, or how do we address the tension between, yes, we want to listen at scale, we would love to get all the information we need, but at the same time, we need to think about privacy concerns. And as I said, sometimes I wonder if people are more comfortable saying more honest things online because they feel like they're not being judged in person. So how do we navigate that?
Well, I mean, this is a podcast, and I'm always worried about saying my true feelings. But I mean, again, these are my views. But I get really frustrated sometimes because, I mean, I do it too, where you realize that all these companies, you're giving your data to them in just free for all. And, we click the yes box and they're analyzing our data all the time. They're just not telling us. They used to kind of publish on it, and now they just kind of do it internally. Whereas we go through like massive IRB, we also have such restrictions on kind of the data that we're able to use, but also the data that we use is we de-identify it and we aggregate it. So we're not singularly like pointing out people in that way. I'm less worried about the like researcher that's in the lab going through IRB, which is Institutional Review Board, and I do think in other countries, for instance, like Europe, like the European Union, they have a lot of restrictions in terms of what type of information companies are able to capture and to be able to use. And I think we could use kind of more of those restrictions, for instance, in the United States. Um, but in terms of, again, vantage point, but from my research area, I think it is, I mean, it's very beneficial in terms of the research sense to really understand how people are really feeling or the experiences they're really having. Like, one of the studies that I did, was, looking at kind of the racism online after the term like Chinese virus was used, for instance. And kind of a big reason I did that was because I was so shocked at how many people really thought that none of that racism was going on,
Yeah.
right? Until they actually see what people are saying. You
Mm.
know, all the different, like, horrific terms that were being used for this population, and then when people actually finally saw it, then they say, "Okay, well, this is real."
Yeah.
Right? I mean, unless someone is actually being able to describe it or you're actually able to see it, it becomes more transparent and there, right? But you don't actually believe it, unfortunately, if you don't see it, right? Because we just say, "Oh, well, these studies didn't say that, they felt racism," or like, we did a study on racism, and guess what? Everyone said, "No, they're not racist." Do you think that's I mean, is the social desirability kind of bias that we kind of have? So I think those things are I think that's actually so important. But you do have to have protections because there can be a lot of stigma. I understand the fears around like healthcare access and like insurance and having everyone kind of know your potential like disease or condition. But I will say, at least for the research that I do, all of it is aggregated, so we don't, personally identify, people, and I think it should I should remain that way unless people are willing to, um, to say who they are, and, which I think, there's it's shockingly too, but a lot of people are kind of willing to put themselves out there because, they're willing to, help others for for the overall benefit.
No, I agree. And I also wonder about a generational shift where maybe people who grew up today in a world where all of their information is out there, we might see, I wouldn't say less concern of privacy, but people think about data differently. As someone who was born maybe 60, 70 years ago might have a different view than someone who was born 15 years ago and the type of world they're living in. I actually do want to ask you about the practice and that you use for your research. But before that, funny enough, before we start this recording, one of the AI tools I use, I'm not going to name it, I opened it and it popped up saying, would you allow us to record your information for training data? Um, and this would mean instead of the 30 days we have now for storing your data, we would move it to 5 years. The interesting thing, I thought they were not even using it for 30 days because I keep asking, like over the past few weeks, every time I put in a document, I say, do you use my data for training? It says, absolutely not. So even the 30-day was a surprise to me, which I agree with you. Then maybe companies have to have a very clear language because I think of myself as someone who actually reads the fine
Print.
writing. And I think, yeah, and I still realize that just I did not realize they still, when they say, well, that we don't keep it, they're keeping it for 30 days. So that's actually very interesting. I don't know how we navigate a world where corporations, and as I said, even governments should take more responsibility in making it very clear what type of data they have and what they're using it for. But then just moving to your practice, you've published a lot of high impact studies in a lot of journals. And I think you use digital surveillance and using big data from forecasting, I think, Lyme disease to thinking about you said anti-agent sentiment early during the COVID-19 pandemic. I think also with a group of researchers mapped global mobility using smartphone data. Maybe instead of just thinking about one paper that you've done, what is usually your practice? Do you think about the research question and then you think about the data you need, or do you think about the universe of the data that exists and then think about how would we use that type of data to answer a question we might be interested in?
Oh, that's such a challenge a lot of the time. And I do want to go back to because you opened up a can of worms in terms of the data kind of privacy issues, but so remind me. But so I mean, I think we're all very influenced by societal kind of trends, right? Or not even trends, but events that happen, right? So if it's COVID-19, the mobility studies, everyone was working on it. Um, I think a lot of the time too, you don't see from, behind closed doors or how the sausage is made that it actually took 5 years to to do that project, right? By the time, you try to acquire the data, get the funding, get the team, all that through. So a lot of it is it's a kind of sometimes a juggling act, right? You're doing multiple kind of projects at the same time. Um, I mean, if you look at my themes, I'd say, it's obviously around, public health and like the big data aspect, but the other one is like methodology. So
Yeah.
I really try to kind of think of the methods and try to evolve on that in the public health arena, which I think we are much slower to adapt to.
Mm.
Uh, and so I'm always looking for, what's kind of next in terms of the methods that can like add kind of more ability to take, and like I always say this is like ultimately what I do is you take the unstructured data and make it structured because there's so much information out there that what is it 90% of, for instance, communication is nonverbal, right? And so we communicate in that nonverbal unstructured world of like images, to memes, to video, to again podcasts and text that is horribly messy and always in slang. The joke is that, do you think as public health officials, we can ask people to not use, acronyms and not use slang so that we can better analyze the data and for it to be cleaner because we have to spend so much time cleaning it. But like that's ultimately what I want to do, right? So I kind of really kind of start there on that aspect. And then I'm always, I think always at the back of my head is I'm always kind of looking for ways to kind of uncover uh, kind of hidden beliefs and behaviors that we traditionally haven't been able to hear or find. It's like
Yeah.
ultimately, and so that always kind of drives me, right? I'm really interested in that type of dark underbelly
Yeah.
of of truthfully kind of like society, and that goes all the way from like how you're eating, how you're drinking, how you're behaving, how you're and what is was causing those types of shifts. And so kinda going from there, then kind of the different kind of projects emerge.
Yeah. So I have so many questions on this, especially I don't know, maybe I'm actually now using this conversation as a way for me to think about using big data in my research. But I have a lot more questions on this. But before we move to those questions, I thought you wanted to mention also something about the
Oh, the privacy, yes, you're gonna have to the privacy thing. It's so interesting because, part of me, it's like you're the researcher, but you're also the patient, you're also the public,
Yep.
right? And you're all 3 of those hats, plus many more aspects about who you are, right? And one of those aspects is also potentially being someone who is like a minority group. Like
Yeah.
I always think of it as, people, and I'm not an expert in this area. I'm going to say that first and foremost. But for instance, the genetic area, where do you want to get your genetic kind of DNA kind of analyzed, and do you want to know your family history? Do you want to know everything about yourself, for instance, right? And, the one aspect is the more information that you give, the larger the database goes, just in general, right? And so, and in general, there's a huge problem across like different studies, right? Including with women,
Yeah.
where there's not enough data, because they don't donate it historically, right? And so part of it of me as a researcher is thinking, okay, well, we need more of this data to be more representative, right? So in my studies, it's okay, ethics, right? We need it to be generalizable, and we need it to be ethical and representative of populations. But then, as someone who is, a minority, I don't want to do that because it's then it's more identifiable, right? Because there's so few of you. And then I think, well, why do I want to give, for instance, my data to this genetic repository and get information back on data that maybe is like 5 people? I mean, it's not 5 people, but I'm saying for certain populations, it's 5 people. So you're basing all of your information on 5 people. And that's what we do a lot of the time.
Yeah.
Right. And so the privacy issue is so multi layered because it really depends on the population that you are from. Right. And data models are only as good as the data you give it. And so if you're basing it on such a small number, it's such an issue, which is why I just am very hopeful of something like big data, where if there's so many people that we can somehow be able to use that data to find better population kind of
Yeah.
outcomes that are truly actually generalizable. That's
Yeah.
just what I wanted to say because it reminded me when you were talking about,
Yeah.
do I save this data? Well, as a researcher, like, oh, I want to be so
Yeah.
I want the data to be contributed, and yes, of
Yeah.
course. And then as an individual, no, go away. I don't want any of my
Yeah.
data. It's a struggle, and you have to think from that vantage point and that hat for sure, because all of my friends and family that aren't in the field say, "Oh, absolutely not." But then again, then here they go, and my mom's on Instagram too, just giving her data wildly
Yes.
freely, and then won't do any other kind of donation in the healthcare realm area, right? So, but you do feel safer because of the fact, again, because I think it's so many people.
Yeah.
Um, and then, but the other aspect, which I think is, I would say a little bit coercive, is are you going to say no to Google? Are you going to say no to Instagram? Are you going to say no to Twitter when those tools or LinkedIn when those tools are so needed
Yeah.
in a daily life? Are you going to say no to Uber? Who's saying no to Uber?
Mhm.
Because
That's a good point. Even if I say no to all of them, yeah, even if I decided to just boycott everything, I don't know if I can ever say no to Uber. That's a really good point.
that's what they were. Yeah, exactly. It's a safety thing. I mean, Google's pretty hard, but Google Maps. Who says no to Google Maps? No one says no to Google Maps. There's an article, I have to find it. I'll send it to you.
Yeah.
But
Yeah.
it is of I think it's a New York Times reporter that tries to not use her phone
Oh,
for like an entire maybe few weeks to a month. And one of the things is Google Maps, or phoning someone,
yeah.
or texting them to tell them that they're late, or to locate someone. You have to be,
Yeah.
which we all did.
Yeah.
Not talking to the next generation that doesn't have any idea that when you said you were going to meet someone, like you were waiting for
It's
45
not it.
minutes, hoping they were, just late, or if they're lost. I mean, what do you do?
You just go home and hope for the best. But
I
yeah,
just, and you hope that they left you a voicemail.
I know. I know. And the other thing is you actually have to memorize a lot of phone
Oh,
numbers
I know. Do
because
you remember
yeah,
how
yeah.
good we used to be?
Exactly. Yeah.
Oh my, I
Exactly.
still remember some, but it only
Yeah.
only up to the age of what? Maybe 12. And I can remember
Exactly.
every number before then.
Yeah,
Amazingly.
I agree. So this is funny. At BU, they have a survey, and I felt really bad because they have this survey, they send it out to everyone, but there were a few demographic questions they asked, and I knew if I answered all of those, it's just I'm the only person who this applies to the entire school. So the researcher and me really wanted to just get the data in there because I would love to have a comprehensive understanding of what everyone in the school is doing. But I also, like, as you said, the personal side, like they're asking about my ethnicity, where I'm from, and a lot of other identifiers. And exactly what you said, it is I knew at that moment everyone who's going to read the comments is going to know this is Salma. She wrote this. So weirdly, or I guess not so weird, social desirability won, and I think I was very
It's
like toned
always
down
the
the
winner.
right
That's
people.
why
Exactly.
you can't ask people like, "Are you doing X,
Yeah.
Y, and Z that's illegal and well, like, disgusting or like, bad for people?" You just can't, say any of those things. But online, it's quite shocking. They really
Yeah.
do. And it's quite, and you know what? It's so remarkable. And I absolutely love it. I'm not on any social media, but I mean, I have no stake in it, but I just love Reddit. I mean, Reddit is because it's anonymous, so there's a problem with the issue of doing analysis for demographic issues, but there is no better platform than Reddit for finding out the truth.
Yeah.
Just amazing,
I
amazing.
agree. I mean, maybe the winner here is just that if you Google anything, most of the time you'll see that I say something Reddit. I just want Google to give me what Reddit is saying. That's what I've been trying to do.
That
Learning.
me too. Oh, that's nice that we have that common. Really, me too. I don't even look at the AI stuff. I just go straight to Reddit.
Exactly. Yeah. Which is funny what you said because I also don't have social media. So I also feel like a kind of a hypocrite because I did some sentiment analysis using Twitter data, but I stopped being on social media for a long time. So maybe
Mhm.
we'll talk at the end about what we say versus what we preach versus what we actually do in
I
real life.
know.
But really, going back to your research, and again,
Mhm.
maybe I'll ask you to have a conversation after this because now I want to learn more about what we can do with the data that we have. I think a few things came up that I wondered about. So the first one is data validation. So do you think about that? I think it is actually being solved from what everything that you're saying about the importance of sentiment and also I think we mentioned social desirability a lot today. But for those who are not really data nerds who use a lot of survey data, social desirability is that usually when you ask someone something and you're in their face or you call them or they think the person asking wants a certain answer, people usually tend to give the answer they think others want to hear. So I think actually sentiment analysis might answer some of those questions. But maybe let's start with validation, because then I think the other thing I was thinking about with the reverse of social desirability is whether do you think online sentiment could also be driven by seeing everyone jumping on a trend, and does that affect what people also write about the trend? Those are two questions, so maybe
Hmm.
whatever you want to start
No,
with.
no, no. I'll go with the
Yeah,
I'll go with the validation first. So again, is how we deal with it with this digital data is we usually, like the Lyme disease that you brought up, we usually compare it to the gold standard, which is a traditional epidemiological source, right? So with the Google searches for Lyme disease, we compared our model to the Center for Disease Control Lyme disease database, right? And so that is our kind of comparison to see how close it is to be able to validate it for its kind of representability, right? Or of the population. But I think that's where you know, I would like as an editor, which I don't know if I would be able to change, is I would like to kind of change that aspect and I would like it to stand on its own a lot of the time, the
yeah,
digital data. Cause again, I bring it up, but we do that over like 1,000 surveys when we take people's information. And this is a completely different data set and it needs to stand on its own, right?
yeah,
And I think people need to see that.
yeah,
It's a definitely a different representative population. It's skewed younger. It actually has more minority populations, which I think is really good. And so again, what's where I say is you need to merge the two of them, right? And so, for instance, like a study that I'm working on, and trust me, this is a passion project because
yeah,
it bothers me, but it's so hard to get funding on women's health, but and
yeah,
in particular menopause. But just looking at, the study that I'm looking at right now is looking at kind of the EHR data
yeah,
and looking then at Reddit and looking at menopausal kind of symptoms and treatments that people are doing, right?
sure,
And they're not lining up, right? And it's because that's a gap. That's a
yeah,
gap that the clinical records do not have, just overall about menopause, but overall about symptoms, right? Because again, it's more of a challenge for people to talk about, their sexual behaviors and vaginal dryness, and a lot of it is announced in the clinical arena, right?
yeah,
And so right now, I would like to look at it as now as a comparison to be able
mm,
to see the differences and say that, but I don't think it should just be a validation in that way. And I would like to move towards the fact that we're just looking at that data alone to be able to say, hey, this is how people are feeling and it's from a digital source versus this is how people online or that have online access or online are feeling about it. It's like, no, no, no. This is what is being said online
yeah,
versus it being online people. Because we're all using digital sources. I mean,
yeah,
a majority of us are. And again, I don't want to discount people who are not able to access it, but a lot of people are, right? And so, again, as you mentioned in your intro so beautifully, that this is our environment. We think of it as like a physical space, but it is now the environment that we live and breathe and think in and are people on. And so we need to count that as real information. And so that's what I'm always hoping the field is going towards, but it's taking a lot longer than I ever thought it would, but public health is a little bit slower that way, and
yeah,
everyone else is doing it. Like, you have huge Fortune 500 companies, you have huge companies, pharma is really big in it. They are online looking at patient documentation and symptoms and side effects online. Large companies like Nike are analyzing social media data to understand their products and their reviews, and they're not doing surveys anymore. Why are we not doing that for
yeah,
interventions or for products or for health issues, right? I mean, everyone else is taking that data and they're being very successful with it, and yet, you know, I think that's where I say is like sometimes I really do believe in the traditional sense, but I think we just like it needs to be, you know, you can
Like
have
maybe more complementary, right?
yeah,
More
more
complementary data. Yeah,
right? Like you can love traditional food, but you
yeah,
can also like fusion, and then you can
yeah.
also like something completely different and have a different food
That's
a
a
different day
great.
of the week. But
Yeah,
I sometimes think we get really stuck, and I'm there too in public health
yeah.
that, in this type of the standard type of validation that we do and the standard type of representation that we see, which, doesn't even work for politics anymore, to be honest with you.
I agree. And I actually think I'm increasingly being sold just throughout this conversation with thinking about big data as complementary. And it's funny. I actually have written a lot about how we need to use big data. It's interesting, even as someone who worked on a commission and data science and using big data, for me, always think about the validation side instead of thinking about this could just be complementary. Sentiments are important to measure or other things compared to just saying, no, we need someone in a clinic to validate what we were saying. Quickly, and I think we're moving in multiple directions, but everything you say just makes me think about something that I'm working on slash thinking about
The
because
trend, you were talking about trend next. Yes. Did you want to move to that question?
no, the trend question, but before that, I actually wrote I was trying to write up a startup idea because I was thinking no one wants to fund women's health. Maybe if I write it in a very effective way that convince a company that this is something that's profitable, maybe they'll actually fund work on women's health because it's just fascinating to me. Like no one is willing to fund it. But then I would love to talk about the trend.
I mean, truthfully, it makes me very upset. And I think a lot of the time, like leaders make a really big difference in decision making. And a lot of that in multiple areas. Like I'm not just talking about healthcare and in government but in tech and everywhere, if again, vantage point, if they're not experienced menopausal symptoms, why would they kind of invest in it? And
Yeah.
then the other part is I think like we're there too, where like profitability, I mean, it's really tough. I don't want to discount myself either though, right? It's we take I mean, not everyone, but sometimes we don't take care of our health as much as we do investing in like health products. It's very different, right? Like how many times do you and also the system too, like an ultrasound and yeah, I don't think it's easy to get and um but it just, um, it's like fertility, for instance, for even so, the fertility of the system, healthcare system isn't that great, but privately, it can be very good.
Yeah.
Right. And so why do we have to pay for that when people are constantly complaining about the fertility of women going down, but
Yeah.
then it's not free to do any of it?
Yeah.
But then the other perspective again is like the products. Like, I mean, we murder the profit when it comes to makeup and kind of any sort of beauty products, but any sort of anti-aging regimens or like kind of that health, like type of more like wellness, but not the kind of medical aspect of it. And I think that's also historically because we couldn't turn to the medical system as well as much. And so we've had to rely on other kind of sources. Um, but I just haven't I mean, people are trying. I mean, Halle Berry's trying,
Yes. Yeah.
Gwyneth Paltrow's trying. I mean, these are
Yeah.
big influencer people. Like, people are trying. There's a lot of investors, I think it's Naomi Watts. I mean, I'm naming a bunch of celebrities, but, I think they're trying, and I really am grateful for it. I mean, even Michelle Obama spoke about it was so amazing, but she talked about going through menopause while being first lady. And,
Yeah.
and all she had to go through, how she was getting these hot flashes and her makeup was dripping down. And she didn't want to do the speech while she was sweating because she would think that people were lying. All these things that we have to go through that are never talked about.
Yeah.
And so then how do people know that we have an issue? Right. And so we've hidden it so long. And I think that's what's great about I would say actually probably, yes, it's slightly our generation, but it's really the next generation that's really pushing those conversations. They have no fear in sharing. And I think that is incredible because I
Yeah.
do believe that that is how we are going to push forward is, and again, it's online, but to start, and don't get me wrong, it's very hard because there's been a lot of stigma with it, but more people that talk about it, uh, the better it is. And trust me, I do not want to be the first person to
Yeah.
talk about anything, but
Yeah. And they
but
will
I
be captured in data trends. Yeah. When they talk about it, they will be captured in the big data trends
right,
and
exactly,
seeing a
so
sentiment change. Yeah. Yeah.
exactly. So I'm hoping that this data analysis I'm doing in Reddit is going to talk about
Yeah.
symptoms that are never talked about. in the
Yeah.
clinic, and it
Yeah.
doesn't mean they're not real.
Yeah. Yeah.
So, okay.
Yeah. So
Trend.
now going back to the trends. Yes.
Going back to trend.
So
I think so with trends, people always say that. What I say to people is that, this online platforms, these online platforms, social media, they're both a way to capture information, but they're also a way that influences kind of information and behaviors. I think that, it's similar to being in high school and there's a bell bottom trend that's going and maybe you don't like it, but you wear it anyways. Does it then not count as like this person is wearing bell bottoms, whether you believe it or not? And then soon after, maybe you really start just really liking bell bottoms,
yeah.
right? And so I think that that's the influence kind of part is that if you contribute to the dialogue, even though you don't necessarily believe it, it's pushing that norm in that direction, right? Because other people are seeing it, right? It's kind of like the same thing from traditional data, it's social desirability bias. If you are saying you do not do this, then in the records, you're not doing it. You're not drinking, for instance, right? You're because you said I don't drink, I don't smoke. So in the records, it's not showing it. So then everyone believes that's what everyone is kind of doing, and it kind of maybe kind of sets that kind of belief. And online, I think it's even kind of more powerful in that way, where because of the other one is we're on it so frequently, and the whole health belief model, right? Or no, I'm getting it wrong. Bandura's model,
Hmm.
is it social belief model? Is
Yeah.
basically just this idea
The
that
social learning theory. Sorry, I also forgot about that, and I taught a class about it.
okay, so but Ms. Bandura, but basically, we mimic what we see. Right? That's
Yeah.
how children learn. You see someone do something, that's how they learn how to eat, that's how we learn how to language. And
Yeah.
so if we're exposed to it all the time, right, it's about again repetition, you start to kind of believe it. I see it with people all the time. I see people's views have changed so much. I mean, mine as well too, right? Over time, when they used to think one thing, and then all of a sudden, kind of, it's, you know, changed the way that, they think about something and, even behave. I mean, diet's a really good one. How many diet trends are there? And then people follow them and people really follow them because it's like the new trend, right? And so you might not have believed it before, but now you're kind of involved in it. And then the same thing with if you are making it okay to say hateful things at a certain group, that kind of normalizes something, right? And again, we're like disassociating the like online world with the real everyday world, but we spend more time on the online world than we really do
Because
the
yeah. Yeah.
offline world. And I think we interact with a lot more people online on top of it too. And that's
Yeah.
where, especially peer networks, and then again, influencers that you maybe look up to, um, that I think again really are kind of influencing, and we've seen that, right? What was it that, right, Kylie Jenner tweeted that she didn't
Yeah.
like Snapchat and it lost, I think, $1.3 billion,
Yeah. Yeah.
right?
Yeah.
Elon Musk did the same. He said the Tesla stock was too high and the stock went down. So people are very influenced by people, right?
Yeah.
And so I think
Home Depot's now, or sorry, Whole Foods now, sells proteins as soon as I get it to the store. It's not even it's hidden somewhere else because now the trend in diet is that you have to eat as much protein as possible.
mm,
So now I go into Whole Foods and it's just you see it in your face. And I think the New York Times actually wrote about
right,
just focusing on protein right now. Yeah.
right. And because again, it started with the kind of an online trend, right? The kind
Yeah.
of carnivore diet, which by the way, I was way before everyone else because I do love that.
Yeah.
But 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 companies are monitoring that. They're seeing that
Yeah.
and it's influencing people's behaviors. They wouldn't be changing out their stock if it wasn't influencing,
Yeah.
people's behaviors. But again, again, it's the whole kind of validation where, oh, are people really saying what they're doing? Do you really think people are like, again, these surveys that you're getting from a health system that is taking care of your health that you're already so vulnerable in? Are you really going to tell them what you really do in your pastime? And I'm talking about small things is like, how
Yeah.
many drinks did you have this week? Like, do you smoke? Do you do drugs? Do you do illicit drugs? Are you going to answer that question legitimately?
Yeah.
Honestly, like, I'm not saying you and me, I'm just saying in
Yeah.
general,
Yeah.
right? And
Yeah.
so, again, like, that's I mean, I've done a lot of studies on that because I find that extremely fascinating. It's a whole kind of black market of things,
Yeah. Yeah.
but I think that is an area where we could do more research on, is kinda looking at the illicit market, and again, it's aggregated. We're not picking out people, especially on somewhere like Reddit,
Yeah.
but we can really understand what the latest kinda drug trends are, what the mixtures are, what people are doing, how people are treating it, and I just don't
Yeah.
feel we do enough of it because it has to, what, be validated with with again, it's the surveillance part, right? This is kind of an
An early
early
warning system, maybe. Yeah.
yeah, an early warning system. Like, there's, back in the day, the studies, they used to, and again, where they, to be able to understand if there was going to be an epidemic, they would just look at a few kind of sentinel hospitals, right, in
Mm.
certain areas, right, they didn't have enough resources in certain areas to be able to cover the entire area or country. So they would pick kind of a couple sentinel hospitals, and if they started to have an outbreak, they knew that it was going to be massive, right? And so, like,
Yeah.
can we do the same? Can we look at a few influencers, and studies have been done? Can we look at a few people that are maybe these centers of the social network to see, what they say and how that trend will change? I mean, look at kind of, again, Joe Rogan and his
Yeah.
influence, right? And how that changes.
Yeah.
Uh, and again, that's where I would like to see that the field go, is kind of looking at the how things are shifting, and then us trying to develop kind of interventions for that,
Yeah.
and online.
Gotcha.
Yes.
Okay, so I want to turn to AI now because I think it's the same thread, right? AI just uses a lot more data in different ways. Large language models mostly use prediction and machine learning to try to figure out what to predict next, what we need or we're thinking about. But what I really wanted to focus on here, because I do think it builds on your existing research, is first of all, how is your research changing as you're thinking more about AI and AI being more easily accessible to most of us? I know a lot of people who work in machine learning would argue they've been doing a lot of this years ago before the LLMs were just available as a chat box. But at the same time, I think now is just getting a different understanding among people like me. So I don't know if having access to AI systems through chat box actually change any of the work that you're doing, or do you think it's just the exact same thing that you're doing, maybe on a larger scale? And then I would love to talk about your editorial role.
Yeah, I think, so, I mean, I think that it's changed in the way that it's the LLMs, especially, and, these generative AI tools are so pervasive
Mm.
in both the public, but in the kind of medical realm, that it's hard not to be doing research kind of in somewhat in that area,
Yeah.
especially when it relates to, for instance, ethics, right? Is you have to be able to kind of test these models to see if they, have biases apply to different populations. And so I think that we've done some research kind of in those areas, kind of to test those LLMs, like, from the view, from like an ethics kind of point of view,
Yeah.
and seeing if they, widen or kind of narrow disparities and how they are with different kind of populations. So I think there's that aspect of it. I think that, I mean, that the biggest issue with it is that that field is moving so fast,
Yeah.
right? And so it's a challenge because, by the way that our research pipeline works, is that, the peer review publications, I'm not discounting that, because your replicability is very important and peer review is very important. But by the time you're kind of, you know, ready to publish, the new generative AI tool has already come out, right? So I
Mhm.
think it's having to have more speed in that area, both from the kind of researcher side, but also from the publication side.
Yeah.
So I think that's like a big kind of aspect about it. Um, but I try to not to change my focus on kind of what one of my advisors, Professor David Williams, used to say, is like, try not to go where the wind's blowing, like, keep your kind of sails in one direction, because you'll just get off course, right? So kind of have this northern star that's always there. And so, again, my themes are still there, and the area that I wanna still focus on is kind of, again, this kind of, like, methods area and applying it to public health. It's not necessarily developing, like, really kind of new methods, because I think, again, you know, that the computer scientists in that area are not only are they, doing such advanced work, but their resources are just so massive. We don't even have sometimes, again, the storage and kind of data power to be able to do what they're doing, right? And we don't have the like level of teams that they have, right? But I think applying those and having them answer public questions that we couldn't always answer is where I think like the sweet spot is. So for instance, like I'm very interested in multimodal analysis, right? So like all the data that, again, that's unstructured data. I really want to be able to now take that next step to be able to use it to be able to, again, understand population health, understand social norms, understand those new modes of kind of communication. So again, always kind of focusing on kind of that blending with what I said, right? Is kind of this idea where you're taking that like traditional epidemiology and you're kind of merging it with computer science, is kind of the sweet spot of where I like to be. Plus, again, always having that type of ethical lens, which is kind of the AI wide checklist that we kind of slightly briefly talked about, or if not at all.
Yeah. 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 No, no, I was actually gonna ask about it because, I read the article, I thought it was really interesting. I don't know if you might want to maybe explain to the listeners what you did in that article, and we'll add it to the show notes, but I thought it was interesting because, at least to me, as someone who hasn't been I present a lot and talk a lot about AI, within public health schools, because usually the two reactions I get is people who are horrified and or scared and don't want to use AI at all, or people who are just dismissing this as something that is a hype that's going to die soon. And I usually just present and thinking, like, you can think about it, how to use it reasonably without thinking that this is something that's going to completely destroy the earth, and maybe there's something in between. So I thought that checklist was really helpful for a researcher who wants to just maybe like dip their feet into the field of thinking about AI and public health or clinical medicine, and then they can expand beyond that. But that's just like a great spot for them to start. So maybe just tell us a bit about the checklist.
Yeah. So this kind of stemmed from the aftermath of the big data and kind of ethics paper, the sixth V of
Yeah.
virtuosity, because that one kind of took like more of a landscape kind of perspective, where this one people kind of wanted more like a solution type of base, where well, what do I do? How do I make these kind of assessments? And so that was kind of the impetus for this paper. And I know you talked about it with researchers, but I
Yeah.
would love, you know, people in tech and in like
Mhm.
industry to be able to kind of use this, right? So it kind of goes through, you know, uh, it goes through all these different case studies of kind of using kind of AI, and represented by different places kind of around the world, and talking about like again, their a lot of the research was kind of focused on ensuring kind of ethics of their work, but sometimes those gaps were missed, right? And so, when you have kind of the limitation section, so then taking all of those and then trying to kind of combine them together to kind of see, okay, well, if we were to develop this kind of checklist, what would that look like, and where would that be where we could actually, be able to mark a yes and no, because again, coming from that perspective of ethics, you're thinking, okay, well, what could I do? What could I not do? And what did I miss? And so then we kind of tried to put that all together in this type of checklist. So I can run through it quickly, but it's kind of like looking at model adaptivity, accountability, the development teams, commercial interests, contextual adaptability, accessibility, privacy, your favorite, transparency, targeted solutions, and then generalizability, right? And
Yep.
kind of going through and seeing like, have you been able, are you able to do that? Did you think about it? At least I think is what was really important. And it doesn't mean like you have to have all of them too, because sometimes it's just not feasible. But I think the point I'm trying to make is that like why I would like it to be part of industry so much is that having them really think about these aspects, I think is really is just really important to ensure that like AI is really kind of fair and equitable.
That's interesting. I like what you said about just thinking about it because, we don't have to get into this now, but some of them I read and I thought, excellent. I think that should just be on every list. And some of them I've read and I thought, that could be a value judgment. So that's
Mm.
because then it depends on like what are the values that you're trying to advance in this project versus not. And maybe because I read a lot of population health science work, um, and I think we think a lot about equity efficiency trade-offs. And it was interesting to me that for targeted, I think it was targeted solutions, you said you should prioritize equity, which I think is great. I would agree with that. But this is one of those where I thought, oh, this is interesting because I can see one could argue if you're a commercial interest or you can a government, depending on our resources, we might want to emphasize efficiency. And then I know people always say, then we'll get to equity later or not. But I thought I thought it was a nice space to say, those are things that you need to think about. A lot of them, I think, it should just be always there. Some of them, I thought you leave space for people to think about the different value systems that they're running with for that specific project. But, yeah. So then I have a quick question before we get into your role as an editor, because I love this term. I think it was on your website. You said you worried about AI and cognitive complacency. And I thought that was great. So do you want to tell us a bit about what do you mean by that, especially for people
Yes.
like me who use AI a lot?
I have to actually, I should write an article about that so it doesn't get taken at this point, but at least this is a record of it.
Yeah.
I just really worried that, basically what I'm trying to say is that we've become kind of lazy to kind of think for ourselves.
Hmm.
Right. And I think in general, right, I think, we are in a world where information is just kind of fed to us and
Hmm.
we eat it, without thinking where it came from. Kind of like the food sometimes we eat, and we got better at understanding, where that came from, if it's good for us or not. And before we were just kind of shoveling down food that we really didn't actually understand, both again, the ethics of it, but also whether or not it was good for you or not, or what the ingredients were. And we're much more conscious of that now. But I'm worried at this stage with especially something like generative AI, where they write with such eloquency and such authority
Hmm.
that you take that information immediately and you don't think about uh, that information that is being given to you. And so when it comes to either making kind of decisions, and I know a lot of people are doing it too, including, I haven't done it yet, but slightly of, you enter in, ooh, do I choose this job or do I do this job? Like, what should I ask this person? Or what questions should I ask this interviewer? Or what should I do? That we're just letting a machine decide ultimately. Right. And so we're losing that kind of creativity and innovation. And then we're becoming this kind of like collective hive mind at one point because, you know, AI seems as though it's generating new information, but it really isn't. It's kind of regurgitating information, maybe in just different ways. But then again, it's just regurgitation of information. It's not the actual kind of synthesis and creation of, new insights that you kind of just get sometimes just thinking alone by yourself. I don't think we
Yeah.
think alone by ourselves anymore. We have to ask
Hmm.
something, and I do it too, and then I do not do this because we were trained so heavily not to, but is, cite it. Where is this from? Where is this information from? Did you read the study? Is it accurate? Was the study done well? But instead, we kind of just take the information as it is. And so, but after a while, you kind of get complacent in, you know,
Yeah.
not thinking for yourself anymore. And I worry about that not just for the healthcare room, but for a lot of jobs, a lot of positions. Like even when I read text, it's so similar now. The words and everything and thoughts are so similar. Yeah, yes, but and a lot of it is kind of, when you get generative AI answers,
Yeah.
they're kind of like really general, but then you realize they're not actually that. Like they're not really actually saying that much. Do you remember when you used to write essays and you didn't
Yeah.
really know the topic that well, and then so you filled it with really fancy words, and then you got an, I mean, it worked, right? And so I'm just worried about that. If you don't actually, if you
Yeah.
don't know, if we don't train people, again, that's why traditional is really important. If you don't train enough people with the content, and really understand it, then how can they check if it's correct after a while?
And I think some of the data actually support what you were saying. There was a study, I don't know if it was in The Economist or from MIT, I'm not sure, but we'll find it added to the notes where it showed that people are actually saying they feel dumber using AI. I don't know if that's actually the case, or is this the beginning of people adapting to AI? I know Taylor Cohen, who's an economist, argued against this, but also he's a bit eccentric. I think I saw recently someone writing an article from who used to teach at the UC system, and he was saying he noticed that his students were just not really learning the material. They're just getting A's in the assignments, and then when they have the exam, they don't know what to do with the exam. And as you said, it's just like they're just receiving the information that solves for the code. They were not understanding how the code was created. So they couldn't really translate it into the exam, which is not exactly what you're saying. But I think there are a few examples out there that are should be a cause of concern for all of us. But I also wonder that should push us in thinking, what should we do with the educational system? Maybe we need to rethink how we teach people because, as I said, the traditional method works, but then AI is just so pervasive everywhere that we really need to rethink what we do. But anyway, so thinking about or what should I do if I want to publish on AI in JAMA Plus? Because you're the authority on it. But maybe seriously first, I really wanted to hear a bit about the trends you're seeing of people who are submitting papers to JAMA under the AI banner, but also like, are there any papers you thought they were excellent this year that people should think about or read as they're thinking about how to incorporate AI in their work?
Yeah. So, um, okay. So your first question was just overall, like, what does
The
JAMA
trends. Yeah, yeah,
AI.org want?
yeah,
So I will clarify that JAMA Plus AI is a channel. So it's a collective of all the journals, like in the JAMA network. So JAMA, JAMA Ophthalmology, JAMA Neurology, JAMA Network Open, JAMA Pediatrics. And it basically collects all the articles that are related to AI into a single channel. So if you go there, you can see the latest AI publications that are across the network, right? Instead of having to go to every single journal. So it's just a one-stop shop to be able to get all that information. Plus, we have our JAMA AI plus conversations, and then we have, other multimedia content, interviews, and then and news articles that are all on this kind of, again, single type of channel. And so when you ask, how do you kind of get published there? It's still submitting to one of the, JAMA network journals, and then it'll get pushed to JAMA AI.org.
mm,
Uh, in terms of kind of what we're seeing and what we kind of want to see. I mean, we do see we saw a lot. It was definitely the year of large language models. We saw a lot of generative AI papers, some really cool ones that are in the realm of, the really influential article that had a lot of citations was taking a look at how generative AI responds to patients and how they found that compared to clinicians, the generative AI tool was much more empathetic.
yeah,
Which I don't, I mean, I think empathy means you actually have to feel, and I don't think AI is feeling right now. So I don't think that it's true empathy. That's a point I will make. But it got a lot of traction because
yeah,
could AI kind of be the replacement for clinicians? And then that question of, okay, well, do you want AI as a clinician or not? And that will bring me to one of the kind of papers that I did highlight as one of my favorite papers. But so we got a lot of those, and then we got a lot of kind of, again, testing of models. But what we're trying to look for more is kind of perspective articles that are really kind of measuring patient outcomes, making real kind of clinical changes in practice, whether that be, again, the health of the patient, or it can also be the health of clinician as well. Is it going to improve efficiency? Is it going to reduce burnout, for instance, right? Um, I think, the other thing too is, I mean, we are obviously very focused on randomized control trials and trials in general. That's always really important for us. I also think the other area is evaluation of AI tools that are existing or enhancing them, not always having to necessarily develop things from scratch. I think it's also really important. Like, how do you adapt it to maybe a certain population, for instance? How we've seen some of those, which I think are very good. We do have an article out that's with me and a few other authors, led by Alvin Liu, who's a editor, and I would take a look at that kind of call to get an idea of kind of the articles that we are looking for. Um, but yeah, I think what I would like to see in general is I would like to see, I mean, I'm really multimodal focused. I think image analysis is really cool. And I think we have a lot to learn there. I think it's very complicated. And I'd like to see that kind of in the clinical realm. There are some studies that have kind of looked at, image data. So one of them is by Ripart. Um, and it looked at a condition called focal cortical dysplasia. And it's a brain abnormality that is very difficult to, it, it causes a hard to treat epilepsy, and it can be difficult to spot on MRI scans. And so patients can often go underdiagnosed or wait years for surgery. And so what they did is they built an artificial intelligence tool called a graph neural network. So it's, basically like a computer model that looks at how different parts of the brain's surface connect. And what was interesting is they found that over 60% of the brain lesions that radiologists had actually missed, the AI was able to find,
Sure.
right? And so, I think that that is, very impactful clinically, right? Because you can detect, FCD earlier and more accurately, which means they can, access surgery better and have fewer seizures and have better quality of life. And then for, doctors, the AI can provide this type of second set of eyes. And so you can kind of see those subtle patient cues
Yeah.
that can sometimes be missed, right? And so, like, what I liked about this type of study is he's using, again, the methods part is really interesting, right? It's using this graph neural network, which is this type of AI that doesn't just analyze images pixel by pixel, but instead studies it like it's connected, like a connected network, right?
Mhm.
Mapping the regions together. And so it's particularly better at spotting these kind of like hidden abnormalities. And so for me, like that, again, having again, that's really kind of the merging of what I was talking to you about, right? But it's more of like clinical and like computer science based, right? Those type of graph neural networks are very much used in computer science, and they're using it in the clinical realm on clinical data.
Yeah.
So, that's where I really that's where my interest is and what I would like
Hmm.
to kind of be published.
Yeah. Do anything that you see in an article that makes you think, oh, this is definitely not for us? Things that maybe pitfalls people should avoid, because I also think it is fashionable right now, I guess, for people to write about AI.
Yeah, I think the biggest thing that I would say is that, JAMA is still, it's still like it's a clinical journal, so our audience is very clinical. And so it's not a computer science journal, right?
Yeah.
In the way that, you know, mm, the well, the methods are very heavy, and I do like methods. The methods are very heavy. It's very technical. It's very long, and our articles are not also formatted the same way as computer science journals.
Hmm.
And so you have to really kind of understand that and look at how our journal is formatted, but also our audience. So you have to speak to our audience, right? That are our readers, kind of similar in a way to like a listener of podcasts, right? You need
Yeah.
to understand who's listening. And so, when you made the kind of definition of social desirability bias, that's really important because maybe not everyone knows that. And so similarly, I just try to tell people that, you know, this very fancy computer science method is written for computer scientists, but our audience is, public health researchers, clinicians, practicing clinicians, right? And so I think that's a really important focus. So that's like really what I see where it can be fantastic, but it has to be written for our audience because that's who
Yeah.
we serve.
Yeah, that's great. And so then speaking of podcasts, maybe quickly, you have a podcast. I think I listened to, I don't know how many hours of podcasts over the past few days preparing for this episode, but I wanted to ask you, what did you learn, especially because you're interviewing physicians slash academics who are maybe have like their topic experts. But as you said, a lot of us, almost all of us, struggle with thinking about communication. And how do you get people to say something that would be interesting for a general audience, or even an audience who might be an academic or a physician, but not necessarily someone who listens to podcasts?
Oh goodness. I mean, I would say to be as honest as possible, which is really challenging because everything lives forever and it's so hard. But honesty really does shine through. You can hold back, you can filter a little bit, but for it not to be rehearsed is the other one. It's really hard because you wanna say the right thing and, um, you want the questions beforehand, you want, you know, really sharp answers, but it comes across as rehearsed.
Yeah.
So I would say that's the advice that I try to give to myself if I'm doing an interview. If I'm an interviewee with you, but it's really hard because no one wants to be fired and or canceled.
Yeah.
And so that's a real challenge. But and then uh, the other one for me is I think it's really important to be personal
Yeah.
and to tell a story that is personal to you. Like have it relate to something that's in your life. Makes it interesting for me to listen to because you're always going to have more emotion with it. Nothing sounds good when it's monotone. And so if you can, you know, and I try to capture that when I'm an interviewer,
Mm.
is to try to capture a story that resonates with someone, that brings out an emotion that's not just uh, a factual regurgitation of the study that you did. But that's hard. It's actually really hard. And, you know, not everyone's made for camera and not everyone is made for voice either.
And that's okay. Who
Yeah,
want to
but
just
it's
focus?
okay too. But it's okay too. But some people are like, but again, that's why you need teams, right? You need like
Yeah.
communication experts, you need different people because
Yeah.
people are brilliant. People are brilliant in their arena, right? But
Yeah.
it's
Yeah.
really hard to
Or,
pick up a baseball bat if you've never done it before. And like I'm one of
yeah.
them, right? So yeah. So
That's funny enough. I think that's what I tell people as well. Is just we get better with practice, and
yeah,
I think sometimes like starting with a small podcast, is a good way to start, and then hopefully moving from there.
yes,
So
yeah.
maybe
Which
just yeah, go ahead. Yeah.
no, no, no. It's also the other thing is it's so I think I'm hoping that I become a better interviewee being an interviewer, right?
Yeah.
Again, different
Great.
vantage points. So you see what you want and yeah, practice is better. But that has also really helped, right? With JAMA AI conversations is helpful for me because I also learn from people. I learn about the research area. So it's fascinating to me to learn about people's studies, to learn about people's personal interests, why they did it, and the effect that they feel they're having is something that I take with me all the time. So that helps me in terms of, my uh when I'm interviewed kind of in the process. And yeah, you can ask the editor in chief of JAMA
Yeah.
plus AI that I'm nerve wracked all the time if I'm the interviewee and he's all telling me to calm down. So,
I think
so
you're
it's
doing
not like
great.
the nerves don't exist. It's not like they don't exist. They're just hidden behind this like facade.
And the editing is an amazing
Oh, that is,
tool
oh,
as well.
yes, exactly. So that's actually, I'm going to give that other point. Oh my goodness, bless the multimedia and editing team. Cause that's the
Yeah.
other thing when I tell, at least with us, it's not live, that we will make you sound great either way. And there's a chopping block. And so it's okay too. And
Yeah.
you know, you can repeat your answers if you really need to, and you can chop stuff too. So that is a great relief, I will say, which doesn't always happen with a lot of podcasts.
No, I agree. Funny enough, I have one question before my last question, but I did an interview 2 weeks ago with BBS, and I actually think doing this podcast really helped. I know the power of editing because I've done it now. I know they're going to try to make me look as good as possible. It's going to be fine.
Right. Like
Yeah,
their job, it's nice this way because sometimes it's not,
exactly.
no, it's not a gossip column. I'm not trying
Yeah,
to make you look bad.
yeah, exactly.
But
Yeah,
so, hopefully if I look good, you look good too. So
yeah, exactly.
yeah.
No, yeah.
Yeah.
One more important question before
Okay.
my last question. What do you think acting taught you that made you successful in public health research?
Oh gosh. Oh my goodness.
And should we all go back and take acting classes or become actors?
Oh, I have a two-pronged answer to that.
Okay.
I think acting was just the best because man, oh man, do you like face rejection like you wouldn't believe. So that is just, although I will have to say nothing prepares you like academic rejection, because it's like, I mean, with at least back in the day more so, and it's so much was it about a certain kind of look. Like, it's the only place where they can ask for a certain body type, certain height, certain race, certain hair color, and all that sort of stuff. So you would be kind of like a lot of the time rejected on that aspect of it. And so I thought I had a thick skin, but like with academia, it sure, I mean, they go back to the dawn of time and evaluate the entirety of you to like, see if you're good enough for this role consistently. You just, I can't believe how I still need reference letters. It's absolutely shocking to me. So you have to play nice in the sandbox all the time. But the other one too is that you just, especially with academia, you always, I think, similar to kind of acting, you're only as good as your last role. You're only good as your last publication. So you always have to be kind of up in your field, I think, in that way. Um, but yeah, I mean, acting just taught probably the most, truthfully, kind of the most things was about just overall rejection. I've learned more now about it than I did kind of beforehand. Um, I would say the best though is really, like, being in the service industry taught me a lot more. Like, I was a server, waiting on tables, and you really kind of understand that perspective, and you understand like customer service, and you understand to read people's emotions kind of well, and what people want, because so much of it is kind of, again, that's based on, your tip ultimately. And then you also just have a newfound kind of respect for the like being on kind of that other of side of things. But no, nothing prepares you for academia. I think does anything prepare you for academia? I don't think anything prepares
I
you
don't
for
know.
academia. It is so different from every other industry. It truly is, it's so small.
Yeah.
Again, the smallest minute thing, you're critiqued for absolutely everything, both for your paper, or both what degree you did it in. Everything is just scrutinized so much. Don't get me wrong, there's so many aspects I really love about it, but I really don't think there's anything kind of like it.
Like
It's very hard it's very unrelatable. It is probably one of, again, I don't know the other areas and fields, but I'd say it's one of the most challenging areas to relate to, because there's so many different complexity and layers, right? Like tenure and promotion, and then publication, and then like the balancing of all of that, and what it means. Like, are you really working, but you're kind of at home, just kind of like, coding or doing analysis, but you're also writing, but then you're also doing conferences. Like, it's a weird kind of mix of everything that you kind of get evaluated on. You have to be everything all at once. And then now we have to do podcasts, right? But so that's like hard for people to understand kind of what you overall do, right? I think the traditional academic of maybe like teaching is either long since past, or it's very seldom and far between. That now we do so much that I think it's, like I said, there's nothing that prepares you for
it's an odd world, and I did clinical medicine, I did policy, and then I came to academia, and it's weird because you're getting paid to sit there and think, which is amazing, but it also has all the things that you talked about. So
right.
it's a weird space.
It is.
Uh,
I
yeah,
know it's
yeah,
really hard to, like, measure that you're thinking. It's like thinking about, like, a new equation, right? You
exactly.
spend how many years developing something, and, like, the classic is writing on the chalkboard, erasing it off. But yes, you kinda take those notes, but really you come up with maybe, like, one equation. It's like, "Wait a second, you spent a decade making this equation," or you spent 20 years making the, like, social belief or behavior model that has influenced everything. What took you that long? No, it really did. It actually took a very long time to be able to synthesize, but it's hard to measure thinking.
Yeah, I agree. And then someone might comes one day and actually proves that what everything that you did was wrong, which
Oh
is
my
something
gosh,
also
please don't say that, Selma.
I think your work is amazing. Sorry, I was speaking in the generic term of
Okay,
someone
okay.
comes in, you have your theory for 20 years, and then someone comes
Yes,
in and they're like,
and
that's it.
and
But I
dispels it,
agree. Yeah,
mind-numbingly crushing, right? Your
I
life's
agree. Yeah.
work, right?
Yes.
Or the other one is really bad is like poor Semmelweis, which people don't even know is the person who, developed hand washing when he was thrown into a mental institution and beaten to death, right? Because he wanted doctors to wash their hands. I mean, I don't want
Yeah,
to be that person and then thought
exactly.
of as a genius after I've been dead,
Yes,
for 30 years. For all those other people who said the world was round, when everyone thought it was flat and were hung or burned for and then they're applauded. I don't want to live that life either. Like I
exactly.
would like a nice like middle ground where
Exactly.
my ideas and theories are applauded in my generation and time. Please,
Exactly. Yeah, yeah, I
please.
agree.
Yeah.
Yeah. So always our last question here is the closing question is because we're called complicating the narrative. What is a narrative about AI, digital health, or even public health that you really think needs to be complicated? I don't want to say, I used to say that keeps you up at night, but then I was told maybe I shouldn't ask academics what keeps them up at night because I don't want to hear the answers. But yeah.
I mean, I'll give the answer that you kind of brought up already, which is the
Sure.
cognitive complacency, truthfully. Right. I think we need to think about that more. Like, what is it actually doing to our society and our children? Right? Sam Altman said that there'll be no children that'll be smarter than AI because they'll just be used to AI. So does that mean they're
Mhm.
not think for themselves? Does that mean that AI is going to just do all the creating for us? So I think that's like what we need to really think about. Are we all just going to be in our own silos or all going to be just one big kind of collective brain?
Yeah. Well, that's a
That
rough one to end on.
that's
Yeah, that's
I
that's a
want
good note of
that's
hope.
what I
Yeah.
want to think about. Yeah.
Yeah. Yeah, no, but that's a big one. Yolanda, thank you so much. This was so fun.
Thank you.
This podcast was edited by Zach Leonaris and Catalina Melendez Contreras. It is supported by the School of Public Health and Frick Initiative at Washington University in St. Louis. You can access this and other episodes wherever you get your podcast, or you can watch it on video on YouTube. Thank you for watching.